Labrador here with who's had chronic otitis or chronic ear infections, and she's shaken her head so much with this recent infection that she actually has a hematoma, or basically where the pinna or the flap of the ear is filled with blood. So we are going to treat this by draining it and then actually tacking this down, kind of like a quilt. We do this under anesthesia because, as you can imagine, that would be uncomfortable. We're also going to flush this girl's ears really well because she has so much thickening and so much debris. She's pretty uncomfortable. And then we're starting her on the appropriate medications to kind of get this under control. We actually have, and it looks a little funny, we sterilize buttons, and these are just regular buttons we buy from the store. We sterilize these to help kind of hold down the dead space with this ear. And then we're going to tack this all down so it will look like a little quilt. And I like to leave these sutures in for at least 4 weeks to make sure everything looks good. So we'll get started here. So I usually will make a little small incision, a stab incision here on the bottom of the ear. You can see that's what's in here. So we're going to drain all of this. And then I'll often too inject a little bit of a steroid into this flap when we're done. So you can see instantaneously that's flat. Now, one question I get a lot of times, well, why don't you just drain it and be done? Well, because this will fill back up oftentimes if you don't tack this down, because the body wants to fill it with fluid, and you've broken the barrier here with these two pieces. So cut all that out, and then we're just essentially going to pass a needle through here and start tacking it down. So obviously this is why we've got the patient under anesthesia. I like to do this with a thick, non-absorbable suture and just run it through. And then I'll tie all the buttons on one side. Oops. This is a new pack of sutures, so the end is a little off. So we're going to do these over and over again. This isn't hard to do, it's just time consuming, to be honest. So, okay, we'll see what we get. Okay, so we're all done here. So I've done a nice little quilting pattern. We've got a couple draining incisions that I made. We've also now cleaned this ear out really well, and we're going to infuse her medicine, but you can see how angry and inflamed this is just because of the chronic otitis. And I just did 2 little buttons that will just kind of help to tack this area down. I like them because they just help to keep the tension on there and prevent things from breaking. So we will take these sutures out in a couple weeks. And in the meantime, we're treating the ears. We've got her on steroids for the pain and for the inflammation. We've got her on medications. We always do gram stains or do cytology of the ears because there's not one-stop shopping ear medicine that takes care of everything. So it's very important that you know exactly what you're treating. The ears on this dog actually have 2 totally separate populations of bacteria. The right ear has all bacteria, and the left ear actually has 2 different types of bacteria and yeast. So we're actually going to do separate medicines for each ear based on what we saw on cytology. So again, it's important when you talk about ear infections, it's not just, hey doc, I need ear medicine. It's important to know what's under here. So this dog should do really well.